Dental cleaning, what to expect during a routine checkup. A healthy mouth is crucial for your overall well-being. One of the main components of your dental health is routine visits to your dentist. Regular appointments usually involve an appointment for a cleaning of your teeth and is a vital component of preventive health care. In this short video, we'll talk about what you can expect to see during an annual dental appointment and what it means to maintain your oral health. The very first stage of regular dental hygiene includes a thorough inspection of the dental professional. It involves examining for evidence of tooth decay, gum disease, or any other dental health problems. Dental professionals may also use the X-rays in order to have a more detailed assessment of your mouth and jawbone. It is essential to have this initial check in identifying potential issues earlier and to determine the most appropriate treatment. Following the checkup after the examination, the dentist hygienist can begin cleaning the teeth. It usually involves taking out tartar and plaque from the teeth by using special tools. Plaque is a sticky layer of bacteria that builds up over the teeth. It could result in gum disease if not cleaned often. Tartar, however, on contrary, it is plaque that has hardened and cannot be eliminated with expert dental instruments. While treatment, the dentist will additionally polish your teeth to take away any stains on the surface and create a smooth surface. This will not only enhance the look of your teeth, however, it also reduces the likelihood of them becoming susceptible to buildup of plaque. A hygienist can also clean your teeth to get rid of the food particles or plaque which might be stuck between your teeth. When the treatment is finished, the dentist will apply a fluoride treatment in order to improve the strength of enamel as well as protect against the development of dental cavities. It is a mineral which assists in the remineralization of teeth to prevent tooth dental decay. This procedure is crucial for those who are children or adults with a higher likelihood of developing dental cavities. Apart from the cleansing and cleaning, your dentist can do a periodontal check to evaluate the health of the gums. It involves assessing the size of the pocket between gums and teeth in order to check whether there are the signs of gum illness. If there are signs of gum disease, dental professionals may suggest other treatments that address the issue and to prevent further injury to the gums as well as the surrounding teeth. All in all, regular cleanings of the teeth are necessary to ensure excellent dental well-being. They assist in eliminating tartar and plaque off the teeth, stop cavities from occurring and gum diseases, and maintain your smile at grade. Checkups on a regular basis also help your dentist to identify problems early and recommend the proper treatment in order to stop any complications from occurring. For the best oral health, it's recommended that you visit with your dental professional for dental cleaning and checkup every 2 to 3 times each calendar year. If you have concerns concerning your oral health or you're having any issues, such as tooth pain or bleeding gums, don't be afraid to book the appointment to see your dentist. Keep in mind that prevention is more effective than treatment with regards to the health of your mouth. Regular dental visits is a vital aspect to maintaining healthy oral health. Knowing what you can expect from a regular checkup, it is possible to feel comfortable about taking the care of your teeth as well as gums. It is important to prioritize your oral health with regular dental visits and following the advice of your dentist to maintain good dental hygiene. Your smile will be grateful for it.